Hey, it's Dr. Hannah with this week's Hot Topic. Today I want to talk to you about high blood pressure and why it's super important to maintain healthy blood pressure levels. Now, last week I talked about high cholesterol and why it's important. So today I'm going to do the exact same thing that I did cholesterol to hopefully help you realize that you shouldn't ignore your blood pressure, especially if you know you have high blood pressure. You should be checking it every day, every morning, keeping a log of it, checking at the exact same time. There are natural ways that you can naturally lower your blood pressure. Diet and exercise is the biggest thing that you can do. Acupuncture, there are supplements that work really well. Chiropractic adjustments work really well to lower your blood pressure. So if this is something that you're concerned about and you come in for a visit, we can check your blood pressure before and then check your blood pressure after to show you the significant difference that it can have on your body. And then the other thing that some people, or a lot of people do, is they take blood pressure medications from their doctor. Again, I'm not a huge proponent of blood pressure medications. That's your choice if that's what you have to do, but there are other alternatives that you can use. But diet and exercise is kind of the biggest thing that you can do to maintain healthy levels. A healthy blood pressure is 120/80. That top number is called your systolic number. It's how hard your heart has to work. The bottom number is your diastolic, and that's when your heart has to rest. So if you don't know what those numbers are or what they mean, that's what that means. So you want a good range between the top number and the bottom number, between 30 and 40. That's just a good, your heart works and your heart gets to rest. And you don't want them too close or too far away because it puts too much strain on your heart. So I'm going to go over just a couple real quick things. If you don't pay attention to your high blood pressure and you're like, meh, not to worry about it. These are things that you potentially could be setting yourself up for, that if you were a little bit more proactive with your blood pressure and aware of it, you could avoid these things in the future. So first thing that could really happen is a heart attack. Now, most people think like, oh, I don't have that in my family. I don't have to worry about it. If you have a heart attack, it means that your body and your heart is not getting enough blood flow to the heart, and then your heart just freaks out and it has a heart attack, and basically parts of it dies. That's what a heart attack is. Now, why that happens if you have high blood pressure is because our arteries really can't handle that extra pressure in the vessel, and so the vessels tend to break down. They either build up or they just don't get the flow of blood. Now, if it builds up, it's going to potentially break off and then travel to the brain, and that's a stroke. So it's either a heart attack or a stroke are the two main things that you are usually susceptible to when you have high blood pressure. The other thing is an aneurysm. So this goes back to the artery damage. Your aorta, which is this big artery that's in your chest about right here, that's the most common place for an aneurysm. An aneurysm basically it expands, the walls of the artery expands. After a while, it can't expand anymore and it's just going to break, and then you're gonna just die in about 3 seconds. So that's something that's super serious, but again, that's what you're doing with a high blood pressure. If you're not maintaining it, you're causing that artery damage. That's potentially a serious, super serious side effect that could happen if you don't have a heart attack or a stroke. Heart failure is another very common thing that can happen. So just think of it like you're working extra super hard and all of a sudden you get really tired. Your heart does the exact same thing. So after a while, your heart is going to get super tired because it's working so hard and it doesn't necessarily have a chance to rest. Now with heart failure, it also comes with kidney failure. High blood pressure is the number one reason why you have kidney failure. If your kidneys aren't working, your body is just going to shut down. It's not going to last very long without kidneys. So high blood pressure is the biggest reason why people have kidney failure. Eye problems are another thing that can happen. So we have arteries that go to our eyes that make us see, and after a while, if there's so much blood pressure, it's going to damage that arterial flow to your blood or to your eyes. So you could actually go blind. You could have vision loss, or obviously vision loss is blindness, but you can have blurriness. You can have other things like nighttime driving that you can't see, cataracts, glaucoma, all those other not good vision problems that you don't want. So those are something that, again, can be avoided if you just maintain healthy blood pressure levels. That's something else your optometrist can see in your eyes. It's called arterial nicking that they can actually see. So if your optometrist actually mentions like, ooh, something doesn't look right, and that's when they're looking into your eye at the vessels, that it can show up in your eyes. So don't think that you can kind of hide it from any other doctor because they're going to check it too. The other thing that is super common that a lot of people may not associate it is sleep apnea. And it's kind of one of those things that the chicken or the egg, but they kind of make it worse. So sleep apnea is when you're not getting enough oxygen, and usually it's your loud snoring, you're super tired all the time because you're not getting a restful sleep. Now, because of the high blood pressure, you're not getting enough oxygen, and therefore you're constantly snoring, but then you're not getting a restful night's sleep because you're not getting enough oxygen and blood flow to the area. So it's kind of one of those things that it's just one happens, then the other happens, and it just makes it worse, and it's just a health problem that's kind of constant. If you're a truck driver, that's one of the things that they check you for, is sleep apnea and high blood pressure. So those are the things that are really important on. So usually if you have sleep apnea, you probably have high blood pressure too, that maybe not necessarily is under control. So those are some serious side effects that you can have if you don't control your blood pressure. Again, diet and exercise is really the easiest way of controlling that blood pressure. Supplements, acupuncture, getting adjusted, and you can take some medication. So hopefully you're not just going to blow off if you have high blood pressure. You're going to take it a little bit more serious because it is a serious health cause and symptom. So hopefully you can kind of get that thing taken care of, and then you can live a happier and healthier life. That's all I have for you guys this week. We'll see you guys next time.